right, so for our podcast subscribers today, buckle your seats. So you've got Jodi, and we're going to talk a bit about Bind and just transformation in the benefit space, as well as an investor. And as Jodi said, I do know her. She's one of our board members, and we're going to have some fun today. Let's just start out with an introduction for our audience. Tell us about yourself and Bind Benefits.
Thanks, Shay. Hi, I'm Jodi Hubler, president of Bind. I'm also CEO and managing director of Lemhi Ventures, the health fund that actually incubated and started Bind. Bind's really unique, Shay, in that we are a zero deductible personalized health plan that allows members to make care choices with full price certainty and incentivizes members to choose the highest quality solutions.
So let's dig a little bit into Bind, Jodi. So as consumers, we're often just in the dark when it comes to making healthcare decisions. So how do we change consumers' role in healthcare decision making for the better?
Yeah, well, first, we make it relevant and contextual to the individual. One of those opportunities that seems to have been lost in the advances of the last 5 years through the democratization of data and the decentralization of care, while it created this rush to service the consumer and the digital health gains that were supposed to make the consumer the point of care or the center of the ecosystem, enabling that decision making. Unfortunately, the burgeoning digitization has actually, quite frankly, overwhelmed the consumer. A significant amount of noise and all fighting for the attention of that individual. And decision making, well, it's quite frankly remained fraught with confusion. Too many voices coming at them, too many point solutions, apps, widgets, recreational medicine, medical entertainment, and at times, frankly, just irrelevant information. And so for consumers, that decision making has become quite fractionalized. I think one of the things that the last 7 months during the pandemic has brought about has been an arresting. It has prompted us to become even more engaged consumers of healthcare. You think about where we were in March, and nearly overnight, we were forced to rethink where, how, when we get care. And fundamentally, we were also forced to think about what health means to each of us as individuals. And items we once viewed simply as convenient, quite frankly, became imperatives. So making those better healthcare decisions in the midst of COVID, when it actually silenced the noise, it exposed the need for creating opportunities for frictionless consumer decision making. And quite frankly, that's just a monumental step in the right direction. When we have those consumers and we give them the opportunity to have the information, we make it convenient, contextual, and relevant to them as individuals. Well, they have the opportunity to reduce waste, improve the quality of their decision making, make better and informed decisions, and frequently often lowering the cost of healthcare for themselves, for their plan sponsors, and then ultimately the impact we can have on the country. So we're seeing that people are willing and able to seek out the right kind of care. When we put that into the palm of their hand, they're often incentivized to make those decisions about, good and effective treatment, being able to make decisions about sites of care, and often those decisions then lead to better outcomes. All of that gets wrapped into a financial underpinning in the context of their insurance, which is great news for consumers. But overall, as a healthcare industry, we've got to be willing to give people the tools and the personalized information that they need to buy healthcare better, more active and informed consumers. And it all has to be integrated into a platform that can be navigated with the ease that we've all come to expect in our everyday lives.
You talked a lot about the consumer choice piece, and I appreciate that because I think a lot of our listeners, don't even really think of themselves as consumers within healthcare, and that is one of the most frustrating aspects of engaging the healthcare system. And so you walk through kind of a litany of opportunities this presents, but clearly you see consumer choice as a central element of better plan design at Bind. So why is that so important for the model you guys are moving forward and change in healthcare?
Yeah, Shay, it starts at, take Bind and set that aside for just a second. It starts at a fundamental human level. choice is just fundamental to a number of components of effective insurance design, but more, it is um, at a human level, just at a basic human element, the ability to have choice, to acknowledge that as a human element, it creates empowerment, agency, ownership, advocacy, and even hope. Choice is critical because it underpins every other decision we make as consumers. And nearly all other buying decisions in our lives offer that ability to have cost certainty, compare options, inherent choice. So at some level, it's somewhat absurd that consumers don't have that in their health decisions, which is why it's so critical for insurance design to be purpose built to deliver choice. And in the current system, we at times leave them to either an overwhelmingly ill-defined or overly narrow experience. And his health insurance historically has been able, or excuse me, hasn't been able to deliver an integrated, seamless experience. But we have the tools now. We have the data, we have the technology where we can deliver it. And Bind is doing that. Bind is giving choice unlike they've ever seen before in a platform that provides treatment options, cost and coverage certainty. And what's really interesting is we often frequently hear people wondering, well, are people really going to be able to make those right choices? But they are. And in fact, what's funny is that frequently we actually hear, why hasn't anyone told me this before? Why hasn't anyone told me that at a simple level, even just my turn signal could be worth $40, whether I turn left or right and make a choice of pharmacy could save me $40, $60, whether a site of care for where I go and receive a procedure could affect the cost and quality and outcome for me. That ability to see that choice, to give them agency and ownership and advocacy over those decisions leads to better outcomes for everyone.
Just love what you guys are doing. So exciting. Power to the people for our listeners in healthcare. So obviously, employers play a crucial role in leveraging innovation in health benefits. What advice do you have for employers listening as they consider bringing in new insurance design?
Yeah, I'm going to begin with my closing statement. I'm going to come to it again. I think in the employer community, we have got to fight the status quo. And I say that as a member of the employer community. Bind has 300 plus employees. I spent prior lives on the HR side, on the buy side of this equation. And the employer's role and their importance is just undeniable. I mean, at some level, and we all know the statistics, Shay, for a significant number of our population, employers provide the financing for one of the most critical components of a human's existence, our health, the financing that's required to protect and maintain it. It's where a disproportionate of our population gets their insurance from. And in 2020, so much has been exposed that it presents a very unique opportunity for the employer and the employer market value stream, quite frankly. HR professionals, finance professionals, advisors, consultants, brokers, all across that value stream to advance a unique insurance design. We have the opportunity to embrace this moment and this opportunity. And I would argue that employers in some ways are very similarly situated to consumers, actually. The employers have been in the need for new solutions for quite a long time. The industry hasn't served them well. I know this because I used to be in their seats. We've been languishing in that stretch of high deductibles getting higher, the choices of cost shift and cost share models for over a decade now. So the employers we speak to desire a platform that really allows for that individual contextual coverage, the opportunity to bring a number of the point solutions that are based on disease and wellness into one seamless experience. And a model like Bind offers that unique opportunity to do better. And so I'll say for me that their opportunity for leverage, the call to action about leveraging innovation for me within that employer community is to fight the status quo. Inertia is really powerful, but the risk of maintaining status quo is so much greater now. And we knew prior to 2020 some of the consequences and the cost of bad insurance design. And I get a sense at some point that there's this fear that to actually make a change might cause some to feel kind of vulnerable, like they either were wrong before. And I think actually that's a bad framing. It's really actually about having an opportunity to do better now. And for us, we feel that Bind provides better. It's a way forward. It's a health plan that provides benefits to both the employers and the employees, and provides the employees with choice. So becoming educated about their options, their coverage and cost clarity is just a great first step.
So I love this concept of a personalized health plan, and I appreciate your comments about the employer community. I think we can all agree, competition for talent and the role of benefits in being able to attract talent has always been critically important. But, as we bring in the next generation and the expectations of both experience and personalization, if you're an employer out there, you should really be talking with Jodi and thinking about not just how to offer great benefits to your employees as a competitor, but to really be distinguishing your benefits package to be able to personalize for your employees. So I love this concept of the personalized health plan. So how is this concept going to continue to evolve and get richer inside of Bind? What does the future look like?
Yeah, I think, let's go a little off the near term, this choice and cost clarity, and let's go all the way towards this kind of vision and futuristic, right? Where the ultimate potential of personalization creates an incredibly powerful platform. And we can envision a day where employers have the opportunity to improve the subsidization for things that they know are important to their unique employee population. Let's talk about mental health, childbirth, the ability to really go after some of our chronic conditions. And with that, that alignment would provide an opportunity for more robust benefits to those with the conditions that need that protection and additional assistance. That allows us then to also focus on a way that as we evolve, we have an ability to address health disparities. It means, lowering the cost of treatments and medications that are known to be particularly effective in treating certain conditions within at-risk populations. For instance, we have an employer who has actually incorporated free insulin. We also see where this allows for a more inclusive benefit, an experience that's very hard to offer when a plan design is one size fits all. So inherently, the more personalized the health plan becomes, the more incredibly powerful it is, and allows for that alignment of employer and employee at that level of personalization. More near term, we're expanding that risk profile. We're moving from employer sponsored benefits into fully insured. We're bringing personalized health plans to a wider range of people and employers. We also have, and will continue to search the industry for evidence-based treatment programs that aren't typically covered by other plans. And that allows us to align with that philosophy of personalization, the ability to integrate treatments and identify those that have low cost or no cost programs for members. They can now know the full expanse of their options when digitally integrated. So we're expanding that condition-based benefit design with specific pages, if you will, or specific construct that integrates with our digital experience, our mobile first view. And these views are comprised of symptoms, their causes, the array of treatment options that provide that detail in an interactive and easy, digestible format. And those resources really help people navigate a condition-specific treatment that provides that effectiveness of safety and cost information in concert with their physician. But again, all in that mobile and digital platform and experience.
Wow. So, for our listeners, if you feel yourself right now having your mind blown, do not adjust your dial. It really is that cool. So, Jodi, you really caught us up on Bind, and not that we want to get completely away from Bind, but as you mentioned, you are a transformational health leader in our community for certain. And so I want to talk a little bit about healthcare transformation. I also want to dig a little bit deeper for our audience into your role as a leader in our entrepreneurial ecosystem and being here in Minnesota's Medical Alley. So let's start big picture first. We had lots of conversations due to COVID-19. We are experiencing just a ton of change. So my question is, are we experiencing true healthcare transformation happening now before our very eyes? Or are we in just kind of this exciting little bubble that's still going to take years to play out in terms of payment models and telehealth and digital health? Um, are we in a nice little bubble, or are we really transforming?
Yeah, and Shay, you've known me a long time and have known that I like to use the analogy of a coin, where there are two sides to a coin. That coin maintains its value, but when we play that fun game of heads and tails, all of a sudden the attribution of a winner or a loser, comes up, whether you call heads or tails, but a nickel, a dime, and a quarter have their same value, and those two truths have to coexist. And I would say the answer is yes. We are experiencing true healthcare transformation, and at some level, we are in it's hard to label it maybe an exciting bubble, in that the impact of COVID and the pandemic has accelerated a level of deregulation. Telehealth that's been multiple decades in the making is an opportunity meeting its market. But we're also seeing some seismic shifts that we're seeing at some level, unbundling of hospital. We're seeing the arraying of, you used to talk about convergence and coopetition. We're now seeing, fundamental shifts in provider networks that are expanding outside the, clinical capacity and traditional boundaries and geography lines. The Teladoc Livongo combination and what that's creating as a digital front door, the rise of digital first providers and the role of that of the consumer in a way that is seismic. At the same time, we're also seeing our ecosystem, our hospitals and providers having to double down on those core and essential services. We're seeing them have to respond in significantly massive ways. And where before sometimes regulation was a barrier, there have been moments where regulation actually has become a catalyst. Telehealth, physicians practicing across state license, some of the demands of interoperability, and the legislation of plan design, almost unheard of at some level. So on the one hand, this movement into health and all things in our ecosystem having record advances of volumes of capital coming in, of investors flooding in, of companies that Zipnosis here in town, right? Really meeting an opportunity and meeting their market. We're experiencing both. And I think what then has to come out of this is, how do we ensure that the gains that we have made are memorialized? It also has to be that the underbellies that have been exposed are attacked in ways that we come together as an ecosystem and as a market, and start to look at them like we did in my manufacturing days and safeties as kind of the never events, right? That we will lock in these gains and move forward. So I think it's a bit of both. It is absolutely undeniable a healthcare transformation that has to get beyond the quote unquote COVID effect and start to figure out how we lock in these gains for long term.
And as we look to lock in those gains, the innovation that is really pushing things are coming from newer companies, Bind included. You mentioned Zipnosis, Livongo, and others. And so I think we're all tied together in this expectation that the door is open, that we are going to memorialize the changes that have been put upon us by COVID, but take advantage of them. And that's about new models and new companies. So let's talk a little bit about that. Our audience now knows you as the president of Bind Benefits. Of course, you have been a leader with Lemhi Ventures. with a lot of dollars under management, and you have invested in a lot of earlier stage healthcare companies. You also chair the advisory board for Minnesota, and we could spend the next 10 minutes walking through the list of company boards you've been on and work you do to help get new companies started. So, our entrepreneurial ecosystem here in Minnesota's Medical Alley, how would you compare our ecosystem to others, and where do you see our opportunities heading forward as a community?
Yeah, I think um, there's been great gains made, and we need to continue advancing them. I think in our mission within Medical Alley, and our focus here is the global epicenter of health innovation and care. One of the areas that I've seen really come to rally is the business environment, attracting the kind of investment. You mentioned Launch Minnesota. There are a number of other efforts where we're really focusing on increased opportunities for health tech and care organizations to succeed. Involvement in getting the angel tax credit pushed through, various efforts that are focused on SBIR funding, a number of the G-Beta, the University of Minnesota, and a number of the initiatives attracting new funds, bread and butter. We are working as an environment, as an ecosystem that is providing the kind of business environment that attracts and increases opportunities for organizations to succeed. We still struggle, though, with ensuring that we can sustain that leadership position. And so I think there's significant work that we can do. Other states, Tennessee, some others that have really focused on entrepreneurial ventures to not only just capture, but really drive and sustain that leadership position. What can we do to create more incubator support? What can we do to really elevate the opportunity for derivative investment funds that can help those known gaps in the early pre-seed phase? It's not enough to get a $35,000 or $50,000 grant. It's that next stage to get to that $2 million of investment. It's what do we do then between that gap of the friends and family and attracting the kind of, A investors. One of the things that I do think we've done a good job of is increasing is that attraction of talent. A number of the serial entrepreneurs across both the healthcare ecosystem that have chosen to stay here in Minnesota, that have chosen to be advisors, angel investors, to really pay it forward, to pave roads. There's a number of folks, Kyle Rolfing, another fellow board member on Medical Alley, and he and I together back in our Definity days almost 20 years ago, had an opportunity to work with the TechStars program yesterday. And it's that kind of involvement where we're really taking a look at the holistic aspect of the ecosystem, really helping to bring not only that advisory, but access to talent who have also had the opportunity to really pay it forward, I guess is where I would land on that. And then finally, I think one of the things we're doing better about is, our Minnesota nice. Shay, you and I have talked about this before. I mean, at times we suffer from our kind of aw shucks Minnesotan. We're not going to necessarily kind of shout our achievements from the rooftops. And I think some things that we've done to really draw in that awareness to be viewed and to take a stand about being opinion leaders and really tout the innovations. It helps that we're driving massive amounts of capital. You and Medical have touted, our past $1 billion. It's another thing, though, to really actually start to make sure that we're, achieving that in a way that really draws the attention of Minnesota as an entire ecosystem and what's taking place in Rochester to Bemidji and all points in between. We need to continue driving that sense of awareness that Minnesota is a force to be reckoned with when it comes to this opportunity to really grow businesses and deliver an ecosystem that can drive fundamental changes in Minnesota.
And for our listeners, if you've not been to Medical Alley, then shame on you. But if you think of us as Jodi suggested, as just that aw shucks community, come sit down with Jodi and I anytime you want. We'll definitely set you straight. So we've talked a little bit about that early stage ecosystem, and again, just a big thanks to you, Jodi. for being such a leader in our community. And you mentioned the $1 billion. The last couple of years, there have been more than $1 billion raised, and those are records that every year continue to get shattered. So I think we continue to see that investment coming in, but it leads to, sort of my last question, which is about the bigger Medical Alley global epicenter ecosystem. So you mentioned a few different companies. I think people are obviously well aware of companies like United Healthcare and Mayo Clinic and 3M and Medtronic, and we could go on and on. But Bind was created here in Medical Alley. And how has that being created here been a factor in Bind's success?
It's been substantial, from a LIMI perspective, from not only the founder of LIMI, but the founder of Bind, Tony Miller. We've had significant success. This is, I think, our fifth company here in Medical Alley. The access to talent, the folks, this isn't an ecosystem where we dabble in healthcare. You've got the roots of Medtronic, of United, of Mayo, of the interdependence of the healthcare systems, of innovation that, folks like Penny Wheeler and James Hereford and others are leading across the ecosystem. It's just undeniable. And so what that creates is an opportunity for companies like Medtronic and Best Buy leaning in to become customers of an early insurance company. Those that then also attract talent that are willing to come into a new co. They've had some exposure to venture. They understand that there's a real opportunity. So it's kind of the partnership that we've been able to forge with United, a Fortune 6 company that also recognizes the advantage of having and tapping into innovation, the work they're doing in Techstars, the investment in Bind. So I think as a holistic system, it is actually quite a success story. It's had the opportunity to attract the kind of technology innovation. We've attracted the kind of funding. We've been able to increase the talent and created jobs for over 250 binders just here locally in the Twin Cities. And the opportunity to have an impact that isn't just about here, but about across all 50 states and in the nation broadly. So being part of the Medical Alley ecosystem has been significantly influential in the success of Bind.
Well, Medical Alley is certainly proud that Bind calls Medical Alley home. And for our listeners, I would simply like to say, if you don't know Medical Alley, you don't know healthcare. Jodi, it has been a pleasure, as always, to spend a little bit of time with you. For our audience, thank you again for listening to the Medical Alley podcast. To hear all our episodes, follow us on social media, subscribe to our newsletter, and visit us at medicalalley.org.